What if the back pain you've been living with, the aching, the stiffness, the burning, the numbness that shoots down your legs, wasn't just about your bones or your disc, but about something missing at the nerve level, something so fundamental that without it, your nerves literally cannot function, cannot heal, and cannot protect themselves? And what if that something was a group of vitamins so overlooked, so underestimated, that most people dealing with spine problems have never once been told about them? Today, I want to talk about the most important vitamin group for a sick spine. And if you are over 60, dealing with back pain, sciatica, disc problems, or that deep nerve discomfort that just won't go away, this video may be one of the most important ones you watch this year. Stay with me because we are going to go deep today. And I promise by the end, you will understand your spine and your nerves in a way you never have before. Let me start by painting a picture that I think many of you will recognize. You wake up in the morning and before you even get out of bed, you already feel it. That familiar stiffness in your lower back. Maybe a dull ache that radiates into your hips. Perhaps a tingling or numbness that travels down one leg. You shift positions. You try to stretch. And slowly, you ease yourself upright. Sound familiar? Back and spine problems are among the most common health complaints I hear from my community of viewers over 60. And the frustrating thing is that so many people have been told the same things over and over. Take this painkiller, get this injection, rest, wait, and if it gets bad enough, surgery. But very few people are ever told about what's happening at the nerve level, and even fewer are told what those nerves actually need to heal. Here's something important I want you to understand. First, when your spine hurts, whether it's your lower back, your mid-back, or your neck, in most cases, the pain you feel is not just coming from the bones or the discs themselves. It's coming from the nerves. Your spine is essentially a protective highway for your nervous system. Running through the center of your vertebrae is your spinal cord, a direct extension of your brain. And branching out from that spinal cord between every pair of vertebrae are nerve roots that travel out into your arms, your legs, your organs, your muscles. When something goes wrong in the spine, a herniated disc, a bulging disc, a bone spur, spinal stenosis, those nerve roots can become compressed, irritated, or inflamed. And when nerves are compressed or inflamed, the signals they send go haywire. You feel pain, burning, tingling, numbness, weakness, sometimes in places that seem completely unrelated to your back, like the bottom of your foot or your fingertips. This is why back pain is so complex. It's a nerve problem as much as it is a structural problem, and treating the structure alone with painkillers, injections, or surgery without addressing what's happening at the nerve level is one of the main reasons so many people never fully recover. So what do your nerves actually need? This is where B vitamins come in. And I want to be very specific here because not all B vitamins are equal when it comes to nerve and spine health. The three that matter most are vitamin B1, vitamin B6, and vitamin B12. Let me walk you through each one. Vitamin B1, also known as thiamine, is the energy vitamin for your nervous system. Every single nerve cell in your body requires a constant supply of energy to function, and B1 is critical to that energy metabolism. Without adequate B1, nerve cells become sluggish. They can't conduct signals properly. They become more vulnerable to damage and inflammation. B1 also plays an important role in regulating blood sugar metabolism, cardiovascular function, and digestion, all systems that are deeply interconnected with nerve health. For anyone over 60 who is under chronic stress, dealing with fatigue, or noticing that their pain seems worse during difficult periods, B1 deficiency is something worth investigating because stress depletes B1 rapidly. And when your B1 drops, your nervous system feels it almost immediately. Now let's talk about B6 pyridoxine. Vitamin B6 is one of the most versatile vitamins in the human body. It's involved in over 100 enzymatic reactions, many of which directly relate to nerve function and the synthesis of neurotransmitters, the chemical messengers your brain and nervous system use to communicate. But for spine health specifically, B6 plays a critical role in maintaining what's called the myelin sheath. And the myelin sheath is something I really want you to understand because it is the key to everything we're talking about today. Think of your nerves like electrical wires. The wire itself, the nerve fibre, carries the signal. But just like an electrical wire needs insulation to carry that signal efficiently without short-circuiting, your nerves need insulation too. That insulation is the myelin sheath. It's a protective coating made of fat and protein that wraps around your nerve fibres, allowing signals to travel quickly and accurately from your brain to your body and back again. When the myelin sheath is healthy and intact, nerve signals travel at full speed. Pain signals are properly regulated, movement is coordinated, sensation is accurate. But when the myelin sheath is damaged or degraded, which can happen from nutrient deficiency, chronic inflammation, or simply aging, nerve signals become erratic. They slow down, they misfire. And the result is exactly what so many of you describe: that burning electric shooting pain, that pins and needles sensation, that weakness in the legs that makes you feel unsteady. B6, along with B12, is one of the primary building blocks your body uses to maintain and repair that myelin sheath. And this brings us to the most important of the three, vitamin B12. B12 is arguably the single most critical nutrient for nerve health in the entire body. It is directly involved in the production and maintenance of myelin. It supports the health of your spinal cord itself. It plays a vital role in the formation of red blood cells that carry oxygen to your nerve tissues, and it is essential for DNA synthesis and the repair of nerve cells. Here is what makes B12 especially important for those of us over 60. As we age, our ability to absorb B12 from food declines significantly. This happens because B12 absorption depends on a protein produced in the stomach called intrinsic factor, and the stomach produces less of it as we get older. Additionally, many common medications taken by older adults, including metformin for diabetes and proton pump, inhibitors for acid reflux, are known to deplete B12 further. The result is that B12 deficiency is remarkably common in people over 60, and it is dramatically underdiagnosed. Many people living with what they believe is simply aging back pain or nerve damage are actually experiencing the direct neurological consequences of B12 deficiency. And the tragic part is that if caught early, many of these symptoms can be reversed or significantly improved with proper B12 supplementation. Symptoms of B12 deficiency can include tingling and numbness in the hands and feet, weakness in the legs, difficulty with balance and coordination, fatigue, brain fog, depression, and of course, nerve pain that radiates from the spine. Sound familiar? For many of you watching, it might. Now, I want to talk about something that goes beyond vitamins, because while B1, B6 and B12 are absolutely essential for nerve and spine health, vitamins alone are not the whole answer. And I think it's important to be honest with you about that. One of the biggest mistakes I see people make is reaching for supplements, whether it's vitamins, painkillers, anti-inflammatories, and treating them as a replacement for the deeper work that needs to happen. You take a pill, the pain eases temporarily, and the cycle continues without any real change underneath. True healing of a spine problem, especially one rooted in nerve irritation and inflammation, requires a comprehensive approach. And for those of us over 60, that approach needs to be thoughtful, sustainable, and built on a foundation of healthy daily habits. Let me walk you through what that looks like. The first pillar is nutrition. What you eat every single day either feeds inflammation or fights it. For spine and nerve health, specifically, an anti-inflammatory diet rich in omega-3 fatty acids, leafy green vegetables, colourful produce, whole grains, and lean proteins gives your body the raw materials it needs to repair nerve tissue, reduce disc inflammation, and maintain the integrity of your spinal structures. Foods that worsen spinal inflammation, processed foods, refined sugars, excessive alcohol, trans fats need to be reduced or eliminated. I know that's not always easy, but when patients make these changes consistently, the difference in their pain levels is often remarkable. The second pillar is movement. I understand that when you're in pain, the last thing you want to do is move, but prolonged rest and inactivity are actually among the worst things for a spine problem. The discs in your spine don't have their own blood supply. They depend on movement to pump nutrients in and waste products out. When you stop moving, your discs starve, your muscles weaken, and your pain often gets worse. The right kind of movement, gentle, targeted, and appropriate for your specific condition, is one of the most powerful tools available for spine recovery. Walking, swimming, gentle stretching, specific therapeutic exercises. These are not luxuries, they are medicine. The third pillar is stress management. Chronic stress has a direct and measurable impact on nerve pain and spine health. When you're stressed, your body produces elevated levels of cortisol and other inflammatory hormones that increase sensitivity to pain, slow tissue healing, and deplete the very nutrients, including B vitamins, that your nerves depend on. For anyone dealing with ongoing spine or nerve pain, addressing stress is not optional. Whether that's through mindfulness, breathing exercises, gentle yoga, time in nature, or simply building more rest and joy into your days, your nervous system needs calm to heal. The fourth pillar is sleep. Deep restorative sleep is when your body does the majority of its repair work, including nerve tissue repair. If you are sleeping poorly, your spine and your nerves are not getting the recovery time they need. Prioritizing sleep quality is a direct investment in your spine health. Now, let me speak specifically to those of you who have been diagnosed with conditions like sciatica, herniated disc, lumbar stenosis, or degenerative disc disease. Because I hear from so many of you who feel like your diagnosis is a life sentence, like the best you can hope for is to manage the pain and slow the decline. I want to offer you a different perspective. The spine has a remarkable capacity for adaptation and recovery. Even after 60, even after years of pain, even after a serious diagnosis. I have seen this in my own community, time and time again. People who were told they would never be pain-free, who found the right combination of nutritional support, movement, and lifestyle change, and who transformed their quality of life. It doesn't always happen overnight, and it requires patience, consistency, and the right guidance. But it is possible, and you deserve to know that the B vitamins we talked about today, B1, B6 and B12, are an excellent evidence-based starting point. If you haven't had your B12 levels checked recently, I would encourage you to ask your doctor for that test at your next visit. It is a simple blood test, and the information it gives you could be genuinely life-changing. If you're already supplementing, make sure you are using the right forms. For B12, methylcobalamin is generally considered the most bioavailable and effective form, particularly for nerve health. For B6, pyroxyl 5-phosphate is the active form your body can use most readily. And for B1 benodium, a fat-soluble form of thymine, has shown particularly strong results for nerve-related pain and diabetic neuropathy. As always, talk to your doctor before starting any new supplement, especially if you are on medications. But don't be afraid to advocate for yourself and ask the right questions. So let's bring everything together. Your spine is not just a stack of bones. It is a living dynamic structure that protects one of the most vital systems in your body, your nervous system. And those nerves branching out from your spinal cord into every corner of your body depend on specific nutrients to stay healthy, conduct signals properly, and heal when they're damaged. B1, B6, and B12 are the foundation of nerve health. They build and maintain the myelin sheath that insulates your nerves. They support energy production at the cellular level. They enable the repair of nerve tissue. And their deficiency, which is far more common than most people realize, especially after 60, can directly contribute to the pain, tingling, burning, and weakness that so many of you are experiencing every day. But vitamins are one piece of a larger picture. Nourishing food, consistent gentle movement, stress reduction, quality sleep. These are the pillars that support everything else. You deserve a spine that allows you to live fully, to walk, to move, to engage with the people and activities you love without constant pain holding you back. Start with your B vitamins. Get your levels checked. Talk to your doctor. And then take one small step today toward the broader lifestyle changes that will support your healing for years to come. I hope this video has served you well today. I only wish you the very best of health. Please share your questions and experiences in the comments below. I read every single one and I love hearing from this community. If this was helpful, please share it with someone you care about who might be dealing with back or nerve pain. It could make a real difference in their life. I'm Dr. Emily Carter and I'll see you in the next video. Take care of yourself. You are absolutely worth